Hello.
Hi,
What's your name?
Otogo Peter.
Okay. My name is Regina Ekong, and I'm one of Brandman University DNP student, and I'm here to provide your care. So what brought you to the hospital today?
I'm here to get a physical.
Okay. When was your last time? When did you see the doctor last?
I last saw my dentist last month, and I got a physical last year equally for my
Great.
job. Okay.
Great. What do you have any medical history?
No.
So I'm going to be asking you some series of questions before we even get started, okay?
All right.
Do you have any medical history?
No.
Any allergies?
No.
Any medications?
No.
Are you taking any medication like over the counter or some?
No.
Okay. Do you have surgical history?
No.
Any psychiatric history?
No.
Do you have your immunization up to date?
Yeah, I took the flu shot this year equally.
That is very good. What about your social history? Do you have? Do you smoke?
No.
Do you drink?
Occasionally, not often. Probably special events like Thanksgiving, Christmas. That's just it.
Good. May I ask what you drink?
Alcohol?
The hard liquor?
No.
Okay. Okay. Do you take recreational drugs?
No.
Like cocaine, like weed, like vaping?
Not at
Vaping?
all. Not at all.
Okay, that is good. I would like for you to tell me about your family medical history.
Yeah,
Does your mom have any history, any blood pressure, any of those?
No.
About
doesn't.
your dad?
No, he doesn't.
Grandfather?
Just my grandparents are all late. Died at old age, and just I think complications from old age, respiratory problems, and that's just it.
Okay. At what age did your grandfather die?
He died at 85. My grandma at 80.
Okay, they live long. And what about your great grandfather?
I have no idea about them.
Okay, okay. What about do you have siblings?
Yes.
Okay. You have brothers and sisters?
I have sisters.
How is their health?
Yeah, okay.
Okay, no history?
No history.
Okay. Okay, at this point I'm going to review your whole system, okay? So I'm still going to be asking you questions again. So bear with me, okay? Right. So I'm going to find out about everything that is going on, anything. Any problem with your head? Have you been having recurrent headaches?
No.
Any eye problem?
No.
Any smelling problem?
No.
Do you swallow well?
Yes.
Any breathing problem?
No.
Any nausea, vomiting?
No.
Any gait problem when you walk?
No.
Have you ever been dizzy?
No.
Have you ever had seizures?
No.
Okay. Do you have any weight loss?
No.
About weight gain?
No, my weight has just been constant for a while. I just take out time to eat properly and also exercise.
Okay, how often do you exercise every week?
Probably 2 days every week.
Very good, very good. It is better to do at least 3 days a week, 30 minutes every time you do it. That is very beneficial, and it's good that you are in the habit of doing that. Okay. Do you sleep well?
Yes.
Any stress?
No.
What kind of work do you do?
Construction work.
You don't have no stress from that?
No stress.
Have you ever had injury?
No.
Have you ever been hospitalized?
No.
Okay. Any bone problem?
No.
Any low back pain?
No.
Okay. Okay, at this point, I would say that we need to go on with the real assessment. So, I wash my hands, and as you see, I've provided enough lighting and privacy so we can get started. So I'm going to start from your head and I walk through to your toe. And doing this, I'll be eliciting cranial nerves 1 through 12, okay? For information, vital signs were done this morning and before this procedure, and your vital signs were good in relation to your BMI, your height and weight, and your BMI, it is good. And also your Snelling test was done, and your eyesight is 20/20, which is good. Do you wear glasses?
No.
Okay. When was the last time you see your ophthalmologist?
Probably like 6 months ago.
And everything was good?
Yeah.
That is good. Okay. I can see that you are well nourished. Your skin is intact, color is good, you are well groomed, you are well dressed, you smell good. Your general outlook is very good, and I'm very impressed. That is good. That is great. And so I'm going to start with your skin, hair, and nail. So like I said, your skin is good color, no rashes, I don't see any erythema, and your nail is clean, no clubbing, no deformation, everything looks good. I'm going to go to your head now. I'm going to look on your scalp. I'm feeling for your scalp. I don't see any bulging area. Everything is smooth, and your hair is evenly distributed. Good texture for your hair, by the way, and it's good. No, looking at your face, I want you to raise your eyebrows for me. That is good. Thank you. Your hair, like I said, your hair is no problem with it. Your hair is evenly distributed and no lesion. So I'm going to go to your eyes. So to your eyes, open your eyes for me. Okay, your sclera is white and your conjunctiva is pink. Your eyelashes and your eyebrow are evenly distributed and symmetrical. That is very good. So we're going down to, I will go now to examine your eye with optoscope. Okay. I want you to open your eyes for me. Just look at me and open your eyes. Okay, I see your brisk, and that is very good. It is, your eye is round, equal, and well reactive to light, okay? There is no edema to your eyelid or anything. So I'm going to check for your accommodation now and conversion, okay? So with this, I'm going to say you follow this. Keep your neck, don't move, just follow with your eyes for me, okay? That is very good. It is appropriate, okay? Your response is good. I'm going to check for your peripheral vision. Tell me if you see my hand. You see my hand?
Yes.
Oh, okay, that is very good. Okay, with that, I would say that your cranial nerve 2, 3, 4, and 6 are intact. So far so good, and we're going to go to your mouth.
Okay.
Your lips are moist, no problem. I don't see any cracking area. Can you open your mouth and say ah for me? First of all, your teeth, your dentition is very good. Your teeth are clean, very good hygiene, mouth hygiene, I would say. And I want you to bring out your tongue for me. I want to be able to see your, okay, pharynx, your oral pharynx, okay. Open your mouth, okay, and bring out your tongue and move from side to side. Okay, it is pink, moist, and intact. I don't see any inflammation. I don't see any problem with it. Everything looks good. And I want you to open your mouth and close tight for me while I press on your chin, the joint. Okay, okay, that is good. I didn't hear any click sound. It is good. Your TMJ is good. And I want to check your gut reflex, but I won't do that because you have been talking to me and everything. Your voice and speech is good. So I would say that your for your mouth, the Grenal 5, 7, 12, 10, and 11 are good, assuming your gut reflex is good as well. Your voice, you're speaking to me and everything is good. So I'm happy with that. Everything is good. So I'll go back to your ear. Your ear, first of all, is symmetrical, very good, and your ear is symmetrical. I'm going to look at your ear canal and make sure that everything is good in there, okay?
Okay.
So I'm going to pull back and go in and look. Okay. It's gray and shiny. That it's gray and shiny, and the cone of light to your right is like facing like 5 o'clock, and the cone of light to the left is like 7 o'clock, which is normal for you, okay? And I'm going to do the Weber test now. With the Weber test, I'm going to be testing for the bone conduction and air conduction. And in a normal situation, the air conduction should be twice as much as the bone conduction. So when I put this on your head, you tell me if you are hearing it on both ears, okay?
Okay.
Just say something that you're hearing or not.
Yeah. I'm hearing.
Okay, that's good. And I'm going to check for the branches.
I can hear that.
Still hearing?
Yeah.
Good job, good, good. So, like I said, the air conduction should be as twice as bone conduction, and in your case, you pass the test because that is the case. Before I go on, I want to let you know that you should stop me if there is any discomfort. I know this is a long procedure, and if you have any discomfort, if any pain, don't hesitate to stop, and I will stop and make sure that you are comfortable before we go on, okay?
All right. Thank you.
So now we have done your ear, and we are going to do your nose, okay?
Okay.
We're going to check. I will check for Brandman nerve 1, which is smell. I want you to smell this for me and let me know what it is. Close your eyes. Did you smell anything? What is it?
Lemon.
Thank you. Thank you. Now we will check for patency. So hold one part of your nose and breathe in through the other, okay? Is that okay? No problem?
Yeah.
Okay. I'm going to look at your oral mucosa, nasal mucosa, to make sure that everything is good in there. Okay. Let's see. Okay. Your septum and turbinates are in place, and there is no deviation, and so it is good. With this, there is no drain. I didn't see any drainage. I didn't see any inflammation. And have you had any runny nose or anything recently? No. So everything is dry and it's good. So I'm going to check for your sinuses, okay?
Okay.
So this is frontal. Any pain, any tenderness?
No.
Ethmoid, any tenderness?
No.
And mastoid? Okay. Maxillary. So everything is looking good, okay? And then we go to the neck. Just looking at your neck, it is round, supple, and I don't see any swelling or anything. So let me feel for it. Move a little bit to the edge of it. Okay, it is supple, no mass, and I'm going to check for the thyroid nodes, supramandibular, occipital, clavicle. Okay, everything looks good. I don't see any. There is no no thyromegaly. So with all the ones that I've checked. So while I'm there, I can check on your jugular vein and measure it as well. Okay. Okay, your jugular vein is 3 centimeters, which is okay, no problem with that. So while I'm on your neck, I'm going to ask you to check your. I'm going to check your Brandman nerve 11, your strength, some of your muscle strength. We're going to do some muscle strength when I do my musculoskeletal. But while I'm here, I need to do this. Okay.
Okay.
Just show your finger, your shoulder. Okay. Push your neck against mine. No, push my hand. Okay, that's good. Okay, that's good. Try to bring your neck to your ear to touch your shoulder, and the same thing to the other side, and up and down. Very good, very good. All that is good. And so we're gonna move on to your lungs, okay?
Okay.
So I'm going to listen to your lungs. First of all, your anterior and posterior posture is good. No barrel chest, no hump back. Everything looks good. No, so I'm going to in and out. Here and here. Here and here. Here and here. Okay, I'm gonna listen on your posterior side. Here and here. Here and here. Here and here. Here and here. Okay, that is good. I'm also going to auscultate. I'm going to listen for your tactile primitives. So with that, I'm going to, when I place my hand on your back, I want you to say something like 99.
Okay.
Okay.
99, 99, 99, 99.
Okay. To the anterior.
99, 99, 99, 99.
That is very good. Okay. Like I said, you have a good posture. There's no barrel chest, no hump back, and so everything looks good. So, have you had any breathing problem recently?
No.
Oh, okay. So I'm going to go ahead and listen to your lungs. Okay. To your heart. Before I do that, let me look at your diaphragmatic excursion and breathing excursion. So I want you to sit back here, move and just take a deep breath in for me. In and out. Okay. In and out. Okay. Your breathing is non-labored, no shortness of breath. I don't see anything like that, so it is good. So we're going to go to listen to your heart. So I'm going to listen to you. This is aorta, pulmonary, pulmonic, EPS, tricuspid, and mitral. The aorta is second left intercostal space at the sternal border. The pulmonic is second left at the sternal border. The EPS is third. The tricuspid is fourth, and the mitral is fourth left intercostal space at the sternal border. So at this point, I'm going to listen to your PMI. So I would like for you to lie on your left, and I get that. Okay, that's good. Are we still good? Are you tired?
Yes, I'm okay.
Okay, okay. I'm going to look at your capillary refill. We look at the hand, but I'm going to look at the leg too.
Okay.
Your capillary refill is good. There is no edema, which will tell something is happening to the heart. Then I'm going to listen to the pulses. Radial, brachial, femoral, popliteal, dorsalis. All your pulses are palpable, +2. Pounding is good. Okay? And I'm going to listen to your carotid pulse. I'm going to palpate it. And I'm going to listen for the brew with my stethoscope on the bell side. Okay, with that, I do not see any brew. I do not hear any brew, so it is good, okay? So, we have measured your JVP, and it is 3 centimeter, and that is good. So we're going to go ahead now and do your abdomen. With your abdomen, I want you to lie down for me. Still let me know if you have any pain, okay?
Okay.
So, can you pull your, so I can, okay, that's good, thank you. Just looking at your abdomen, the skin is good, no discoloration, no rashes, no marks, no bulging area. I don't see any problem. And so I'm going to auscultate. I'm going to listen for vowel sound on the 4 quadrants, okay? Here. Wow, vowel sounds are positive, which is a good sign that your vowels are moving well and everything. And it tells when you're hungry, so that's good. So I'm going to palpate. I'm going to do light palpating, and then I'm going to do deep palpating to check your organs, okay?
Okay.
So. Okay. Deep. I'm going to palpate for your liver. Okay, I can feel it soft and smooth. And I'm going to palpate for your spleen. and your aorta. Okay, palpate for your kidney. Okay, that's good. I could not feel your kidney, but that is a good sign because usually kidneys are not felt on adults. Okay.
Okay.
So with this, I'm going to do the Murphy test. I'm going to press down on your liver, and then I see if you are guarding or some close to your liver, not actually, but a little bit. Any tenderness, any pain?
No.
Okay. That Murphy test, and that is okay. And I'm going to do the SUS test. And with the SUS test, I'm going to press on your hip, and I would like for you to lift your leg as I do that.
Okay.
Go. Okay. Do you feel any pain around here?
No.
Okay. No tenderness, no pain. Okay. And obturator test, I'm going to do that. This, I want you to be with me. I'm going to lift your leg, and I'm going to turn it around and turn. Do you feel any pain
No.
on your abdominal side?
No.
Okay. Your appendix is okay. Everything is fine. So that's great. So I want you to sit back again. When I did your lungs, I did not percuss, and I want to do that.
Okay.
Yeah. Okay. Okay, the resonance is good. So now we're going to move on to your musculoskeletal, okay?
Okay.
We're going to check all your muscle strengths, even though we have checked some already. So we have already checked your cranial nerve number 1. We have checked your eyes, which give us 2, 3, 4, and 6. And we have checked your mouth, 5, 7, 12, 10, and 11. All have been checked. Okay, we are moving through. Soon we'll be done. Okay.
Okay.
And so we're going to check your muscle strength. I
Okay.
want for you to push. Okay. Okay. Push. Okay. Okay. Push. Okay. Okay. That is good. I'm going to do anterior drawer test. Okay. This one I'm going to ask you to bend your knee while I try to twist your joint. Okay. Bend your knee. Okay. It's your knee. Your joint is stable. Okay. The stability is good. And apple scratch test. I want you to put your hands over your head and scratch your back. Can you reach that without any pain, any difficulty?
No.
That is good. That is good. And empty can test will assess your rotator cuff. So empty can, I want you to do your hand, lift your hand up and drop as if you are emptying with your thumb down. Okay, that's good. That's great. Apprehension test. Apprehension test, you have to, I want to hold your hand up and then you bring it down slowly.
Okay.
I let go and you bring it down slowly. That is good because you have control over that and not just drop it. So that is very good. Tunnel test, and that tunnel test is going to test for your carpal tunnel syndrome, and I'm going to tap on your wrist Which one? Okay. This one. Do you feel any pain?
No.
Okay. You feel any pain anywhere?
No.
Okay, that is good. Now we do the fallen test. Fallen test, I'm going to ask you to hold your hand down like this for a full 1 minute. How are we doing with that?
Good.
That is great. So that is good. That is good. Enough,
Yeah.
enough. So we have done all the range of motion. I want you to lift your hand up and bring it to the side. Bring it down. Okay, that is great. We have done all that, and I want us to go ahead and do the neurological examination. So with this, I'm going to ask you to close your eyes, and I'm going to assess for your sensation, okay? I know we have done something with when I put this item on you, you tell me if they are sharp, if they are dull, if they are soft, okay?
Okay. Soft. 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 Sharp. 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 Dull. 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 Dull.
Okay, your sensation is very adequate, okay? It's very much intact, very good. And so I'm going to check your reflexes, okay? Your reflexes. Okay. Okay, good. Bicep. Patella. Okay, that is good. I want you to lie so I can do your Achilles. Move down because this your leg has to be, and move, lie on your tummy. Your leg has to be off the. Okay, that's good. Well real. Okay, you can sit back. Are we still okay?
Yeah.
Okay. I want you to use your finger to touch your nose several times. That's good. Do your alternating. Great. Get up and do your heel to shin for me. Use your leg to do this leg and then you do the other one.
Okay.
No, heel, do this. Use your heel and touch it. Okay. And do the other one too. Okay. That is great. Can you walk on your toe for me? You can walk towards the camera.
Okay.
Okay, walk back on your heel. That is great. Can you do a shallow bend for me? That is good. That is good. Okay, you seem to have done very well. And do you have any question for me?
No.
Let's see if there is anything that we miss. We did all the cranial nerves, which I think we did. We did your lungs and tactile fremitus, diaphragmatic breathing, and respiratory excursion, and check your aorta, and I check all the, I used my belt to listen to breathe, which I did not feel. Let me just listen to the breath again and make sure that I did that. Okay, Okay, everything looks good. So it looks like we have come to the end of our examination, and I would say that you did very well, and thank you very much. And I'm going to tell you that the genitalia is deferred for another time, genitalia and breast examination. So thank you very much.
Thank you too.
You're welcome.